Welcome back to my channel. If you're new here, my name is Neil Gavin. I'm a registered nurse and I do have a degree in medical surgical nursing. I create my nursing educational videos to help nursing students and nursing professionals like you with their studies. If that is something that you are interested in, consider subscribing. If you are already a subscriber though, thank you so much for your love and support. I see you. I upload my nursing educational videos Mondays, Wednesdays, and Fridays. Please make sure to subscribe now, hit the notification bell so that you will be the very first to watch my newest uploads. Also, don't forget to give this video a big thumbs up and share with your friends because that will really help me know that you like to see more contents like this. Without further ado, guys, let's jump into the video. Hi everyone! Kumusta kayo? Isang panibagong nursing discussion nga ang alay ko sa inyo for today. Welcome to everybody who attended the class for today. I'm so proud of you. Give yourself a tap on the back for showing up for today's class. Kumusta kayo mga buhay nyo? And I would just like to congratulate and welcome. I congratulate all of us for moving really fast towards our goal this month, and that's 20,000 subscribers, you guys. Currently, if I'm not mistaken, we're more than 18,000, and I want to thank you from the bottom of my heart. I really do appreciate all of you guys. I actually read all of your comments. I may not reply them, but I want you to know that I'm reading all of them. All right, and I appreciate all of you. Now, currently, just to share to you the analytics of our show, of our YouTube channel. People who are watching my contents, 56% of you guys who's watching are not subscribed, and that leaves me with more than 43% of watchers that are subscribed. So that's in 100%. You guys, I really want to appreciate, I want to grab this opportunity to please and encourage you to subscribe now. Keep on sharing my channel, the links to my channel, share it to your friends, to your colleagues. Let them know that certain channel exists. Especially, help me out do this and get the channel bigger because I really want to reach out a lot of people, a lot of nursing students, not just Filipino nurses, but all over the world. If you're getting the benefits out from my channel, give me a help, give me your hand, and do subscribe now, because the bigger the channel gets, the better the contents, the bigger the contents, and it's just becomes endless for all of us. You know what I mean? So yeah, I'm gonna give you time to do it now. Thank you so much for doing that. You guys are amazing. Now, like you see on the title, this is all about bacterial meningitis. Another entry natin sa ating nursing medical surgical theory. We're MS, where I'm going to give you nursing care management, a thorough nursing care management of this type of disorder. If you haven't watched the other MS lecture I created under my channel, I'll be putting the playlist link on the description box, and or whenever the icon button pops out, click the one out because I'll be putting it there. All right, so this is going to be a little bit lengthy, so without further ado, let's jump in. Let me share to you the objectives for today's discussion. So, on the following, today's lecture, you are going to expect that we're going to answer the question, what is bacterial meningitis? We're going to discuss the causes, clinical manifestations, prevention, complications, diagnostic findings, medical management, nursing management. All right. So these are the, the contents for our today's lecture. All right. So, eto na. Mag-proceed na tayo. Let's answer the question, what is bacterial meningitis? Now, meningitis is one of the infectious disorders of the nervous system. Hence, I put it there. See? The brain. Yes, it is an infectious disorder of the nervous system. May dalawang klase ang dalawang part ng nervous system, peripheral and central nervous system. By the way, if you haven't watched the nursing anatomy and physiology lecture I created under nervous system, check them one out because I'll be check the description box or the icon button. I'll be putting it there for sure. All right. And later this month, I'll be adding a new video lecture regarding the nervous system because it's not yet. It's an ongoing content. All right. So let me give you this definition, clinical definition of your bacterial meningitis. Now, meningitis is an inflammation of the lining around the brain and spinal cord caused by bacteria or viruses. All right. Lining around the brain and spinal cord caused by bacteria or viruses. Pretty straightforward. Now, bacterial meningitis is caused by bacteria, of course, bacterial. Causative agent, bacteria. Meningitis can be the primary reason a patient is hospitalized or can develop during hospitalization. Hence, we need to establish strict infection control. All right, especially sa mga pasyenteng nasa hospital to prevent nosocomial infection. All right, so we're done with the clinical definition of your bacterial meningitis. We're going to proceed with causes. All right, so factors that may cause bacterial meningitis include the following. Listen up, you guys. So tobacco use. Tobacco use predisposes the patient to meningitis. So number one risk factor ng meningitis is cigarette smoking. Viral upper respiratory infection, URTI. Viral upper respiratory infection increase the amount of droplet production. Otitis media, in Tagalog, luga. Otitis media increase the risk of a bacterial meningitis because the bacteria can cross the epithelial membrane and enter the subarachnoid space. Huwag malilito, nasa causes na tayo. Next is immune system deficiency, mga immunocompromised. People with immune system deficiencies are also at greater risk for development of bacterial meningitis. Mga pasyenteng may autoimmune disease, mga nagki-chemotherapy, those patients. Next is bacteria. Diba? Causative agent niya, bacteria nga, bacterial meningitis. Ano yung causative, what's this bacteria or organism? It's the Streptococcus pneumoniae and Neisseria meningitidis are responsible for 80% of cases of meningitis in adults as well as Haemophilus influenzae or influenza in children. Once again, these are the causes of your or risk factors of your bacterial meningitis. Malinaw ba yon? Clear as the sun? Very good. Now we can proceed to clinical manifestations. What are the symptoms of your bacterial meningitis? Headache, mind you guys, headache and fever are frequently the initial symptoms. Headache and fever, very vague yung kanyang symptoms. But initially, it will be manifested as headache and fever. Headache kasi nga, sa brain nga naman siya. Fever kasi may infection. Itis, meningitis. Right? Right. So don't worry, I'll give you more clinical manifestations on the next slide. So like I said, we have headache. Headache is usually steady or throbbing and very severe as a result of meningeal irritation. So those are the characteristics of your headache. Marami kasing klase na headache. Throbbing pain and steady or throbbing and very severe. Meaning, malala. Severe meaning in terms of duration, chronic or acute type of headache. Next is neck mobility. A stiff and painful neck can be an early sign of the head, and any attempts at flexion of the head are difficult. Flexion of the head, very difficult. That's one. Positive Kernig's sign. When the patient is lying with a thigh flexed on the abdomen, the leg cannot completely be extended. Meron din tayong positive Brudinsky sign. Positive Brudinsky signs, which is when the patient's neck is flexed, flexion of the knees and hips is produced. When the lower extremity of one side is passively flexed, a similar movement is seen in the opposite extremity. Ito po yung picture. This is the picture. Take a note of the picture, make a screenshot as your guide. But basically, this is positive Kernig signs and Brudinsky sign. Sa Kernig sign, tandaan mo yung KE. Knee extension is painful. Sa Brudinsky sign, tandaan mo yung letters doon sa words na Brudinsky. NK. Meaning, neck flexion leads to knee flexion. Alright? Alright. That's when you know that it's positive Kernig's and positive Brudinsky sign. Alright? Next, we have photophobia. Extreme sensitivity to light is common finding. Very common. Now, skin lesions. Skin lesions develop ranging from a petechial rash, petechia, with purpuric lesions to large areas of ecchymosis, hematoma. We also have cognitive impairment, seizures. Seizures is one. So cognitive impairment, disoriented, and memory impairment are common early sign in the course of the illness. Kapag nagiging makalimutin o lianin, may disorientation, di siya oriented sa date, time, and place. Isa yun sa mga sign. Seizures as well. Seizures can occur and are the result of areas of irritability of the brain. So seizures is one of the manifestations, late manifestations of your what? Of your bacterial meningitis. Once again, these are the clinical manifestations of your bacterial meningitis. Let's proceed. Prevention. The prevention of bacterial meningitis includes the following. Before I give you that, if you haven't subscribed yet, I'm gonna give you time. Subscribe now. Go. Oh, see, that's easy. That's quick. All right, let's proceed with the discussion. When you talk about prevention, there's only three. We have your vaccine, of course, vaccination. The Advisory Committee of Immunization on Immunization Practices of the Centers of Disease Control and Prevention, alam nyo to, CDC, recommends that the meningococcal conjugated vaccine be given to adolescents entering high school and to college freshmen living in dormitories. Tandaan mo to, binibigay ito. Parte ito ng immunization sa adolescent phase. Alright? So health education is two. One way to prevent it. Most states mandate education addressing meningococcal meningitis. Sa US to. Health teachings to sa atin. How to prevent, what's the modes of transmission, how to break the mode of transmission, of course, and hygiene. Next is antimicrobial prophylaxis. Nag-antibiotic. Prophylaxis lang naman. People in close contact with patients with meningococcal meningitis should be treated with antimicrobial chemoprophylaxis using rifampin, ciprofloxacin, and ceftriaxone sodium. Those are just the examples of your antimicrobial prophylaxis. Once again, these are the steps or the ways on how you're going to prevent the spread or having bacterial meningitis. Let's proceed now. Complications. Don't worry if I'm going too fast. I will be dividing this video lecture into chapters. If you're watching it in YouTube, it's available there. So you can just go back in which area or which chapter you missed out. Okay, you want to brush it up again. All right, so complications of patients with bacterial meningitis and meningitis includes the following. Listen, galaw-galaw, hinga-hinga ha, take a deep breath. Eto na tayo. Visual impairment. Yes, infection may spread towards the eyes if left untreated. So, may visual impairment to. Pwede magkaroon ng loss of vision. We also can have deafness. Deafness may also occur when the bacteria reaches the optic nerve. So, early treatment is a must because deafness can occur in visual impairment. Lastly, seizures. So, bacteria irritates the meningeal layers and may lead to seizures. Once again, these are the complications of your bacterial meningitis. Let's proceed. How are you going to diagnose such condition? If the clinical presentation suggests meningitis, diagnostic testing is conducted to identify the causative organism. Dito na tayo magda-diagnose. If you have positive clinical manifestations and you want to rule out what bacterial meningitis, here are the things that the doctor might order. So you have to prepare yourself. Eto na tayo. Assessment and diagnostic findings of your bacterial meningitis. Let's start with computed tomography, CT, scan, or magnetic resonance imaging, or what we call MRI. This is to detect a shift in brain contents may lead to herniation. So, titingnan kung mayroong positive herniation tayo prior to lumbar puncture. So, key diagnostic test, Key diagnostic test is made by lumbar puncture nga. That's the primary, yung aspiration ng CSF fluid na isisend sa lab. So key diagnostic tests, bacterial culture and gram stain of CSF and blood through your lumbar puncture. Now the CSF is cloudy. CSF is cloudy. Gram stain of the CSF reveals organisms in 70% to 80% of all cases. When the organisms cannot be identified, bacterial and antigens can be determined. H. influenza is frequently detected with this technique. Clients with bacterial meningitis demonstrates the following. Ano-ano yung dine-demonstrate nila? Ito. Moderately, in terms of CSF characteristics, moderately elevated CSF pressures, elevated CSF protein level, normal 15 to 45 milligrams per deciliter, decreased CSF glucose level, normal is 60 to 80 milligrams per deciliter, or 2/3 of the serum glucose value. Hence, nag-check tayo ng sugar level prior ng LP. Ang LP naman ginagawa sa bedside. Normally, kung kailangan ng anesthesia consent, ginagawa sa OR. So, may LP set yan. Sa hospital namin, meron kaming LP set. Of course, kailangan mo ng consent. Ang gagawa niya, neurosurgery. Now, elevated white blood cell count usually increased 100 to 10,000 cubic millimeter with predominantly polymorphonuclear leukocytes. Next, we have your medical diagnosis is made by assessment or key diagnostic tests. For clinical manifestation is confirmed by isolating the causative organisms from the CSF. I want you to understand all the things I said. The primary confirmatory test for your bacterial meningitis is LP, lumbar puncture. Period. Okay? Everything else, yung MRI visualization. Yung iba, key assessment findings ng, assessment findings ng yung clinical manifestations. But, kapag nag-positive yan sa lumbar puncture test, may mga oligoclonal, may mga ganong klaseng test, in-order naman yun ng neurosurgery. So, yun. So once again, these are the assessment and diagnostic findings of your I keep on saying meningeal, like, what's this? Bacterial meningitis. Proceed na tayo sa medical management. Exciting, hindi ba? Are you guys okay? Are you still breathing? Are you still with me? So, you can pause this video for a while, grab your coffee, grab a snack while listening to me. If you're listening to me while you're on the road, that's perfectly fine. Okay. I would love to accompany you. Now, let me share to you this. We're going to proceed. Medical management of your bacterial meningitis. Bacterial meningitis constitute a medical emergency. Yes, this is very true because normally within 8 hours, 6 to 8 hours upon the patient admission, kailangan na natin yung LP. Kailangan na nakuna na yung pasyente ng CSF samples because this is very critical. Kasi ilalagay mo yung pasyente mga first stop sa airborne precaution, droplet nuclei, droplet precaution because this is very highly, lalo kapag sa ward na admit ang pasyente, highly transmissible. Kailangan na sa isolation room to. So, this requires this is a medical emergency. Now, prognosis varies according to the causative organism. The use of antibiotics has reduced the death rate to less than 5% for all types of bacterial meningitis. If untreated, it can be fatal within hours, 2 days. That's why it's considered a medical emergency. From ER, admission sa ER, diretso na yan sa ward, gagawin na ward or ICU, gagawin na ang LP within 6 to 8 hours. Deaths most often occur in newborn infants and in older adults. Complications are rare, but may include septic shock, vasomotor collapse, seizures, and increased ICP, intracranial pressure, attribute to hydrocephalus, brain swelling, and fluid overload. Residual neurologic deficits are rare in adults. A unique problem in treating CNS infection is that highlight an intact blood-brain barrier, yung tinatawag nating BBB. Nako, part ito ng discussion ko ng ng nervous system. ANAFI, nandun to, diniscuss itong blood-brain barrier. Prevents complete penetration of the antibiotic. However, inflammation inhibits the blood-brain barrier. So for short time, the antibiotics penetrate the CNS. Antibiotics are given intravenously. The blood-brain barrier recovers as inflammation subsides, and high doses are required to reach the CSF. So that's just a brief description of your medical management. Ito, ibibigay ko sila sa inyo in detail. Now, before I proceed with antibiotic, adequate fluid and electrolyte balance must be maintained. Frequent assessment of the neurologic status, GCS, level of consciousness is a must. All right, status is indicated to detect early manifestation of increasing ICP and seizures. Anticonvulsants may be prescribed for seizure prevention. Antibiotic therapy. Ito na tayo sa mga antibiotic mo, antimicrobials. Early administration of antibiotic that crosses the blood-brain barrier into the subarachnoid space insufficient concentration or in a sufficient concentration to halt the multiplication of bacteria like vancomycin. Normally, nag-order ang doktor ng stat dose ng vancomycin. Depende sa weight ng pasyente mo. Normally, nakaka-receive ako ng order ng 2,000 milligrams, 2 grams ng vancostat. And then, meron na yung, regular dosing na. Syempre, on your fourth dose, before you give the fourth dose, you need to run what? Vanco level trough. Okay? Check kung may dosage adjustment, or you will remain with the same dose or increase the frequency or decrease the frequency. All right? Depending on the result of your Vanco level trough. Now, we also have medical management corticosteroids. Dexamethasone has been shown to be beneficial as adjunct therapy in the treatment of bacterial meningitis if it is administered 15 to 20 minutes before the first dose of antibiotic and every 6 hours for the next 4 days. Q6. 4 to 6 hours muna bago magbigay ng antibiotic, bigay mo muna yung corticosteroids. Okay, Dexa. Fluid volume expanders. Di ba sinabi ko sa inyo, ultimate goal is adequate fluid. Fluid volume expanders, dehydration, and shock are treated with fluid volume expanders. Alright, IV therapy to. Once again, these are the medical management. Before I give you, we proceed to nursing management. I'm gonna give you time to subscribe to it now. I'm also gonna drink my water. Go. Thank you so much for doing that. Without further ado, eto na tayo sa nursing management. Diba malapit na tayo matapos sa ating discussion ha? Nursing management na po to, which I divided into 2, nursing assessment and nursing intervention. You guys, listen up. This is very important. Wake up, wake up. The patient with meningitis is critically ill. Therefore, many of the nursing interventions are collaborative with a physician, respiratory therapist, and other members of the healthcare team. Nursing assessment and nursing intervention po ang ating tatalakayin sa mga susunod na slides. Let's start with your nursing assessment. Nag-intervention ka agad? Hindi ka naman lang wala kang assessment. Anong basis ng intervention mo? 'Di ba? Very important. Adpay pa rin tayo dito, girl. So, assessment of the patient with bacterial meningitis include the following: neurologic status. What did I tell you? Check of GCS. Kung nasa ICU Q1, kung nasa ward Q4. Okay? GCS, kasama niyan yung GCS level, level of consciousness, GCS scoring mo. Okay? Orientation ng pasyente mo. Neurologic status and vital signs are continually assessed. Pulse oximetry and arterial blood gas, ABG. Magra-run ka nito. Depende sa order ng frequency ng doktor. Kung alam gusto niya, OD, BID. These values are used to quickly identify the need for respiratory support. Baka naman nagdidisat na yung pasyente mo. Or mababa ang oxygen sa yung arterial oxygen. O baka mag-start tayo ng BiPAP, oxygen therapy such as face mask or nasal cannula or even non-rebreather mask. Okay? All right. So once again, this is your nursing assessment. Let's proceed na with your nursing interventions. What are the things, the actions that you need to do as a nurse? So important components of nursing care include the following measures. First is assess neurologic status and vital signs constantly, meaning as per your SOP. Like I said, kapag sa ward Q4, kapag sa ICU Q1, period, wala tayong pag-uusapan. Determine oxygenation from arterial blood gas values and pulse oximetry. Insert cuff endotracheal tube, ET tube, kapag nagdedesat ang pasyente mo, kapag kailangan tubuhan. The position and position patient on mechanical ventilation as prescribed by the doctor. Assess blood pressure. Usually monitored using an arterial line for incipient shock which precedes cardiac or respiratory failure. Arterial line na sa ICU to. Okay? Makikita mo yan. Rapid IV fluid replacement may be prescribed but take care not to overhydrate. Baka mag-overload ang pasyente. Overhydrate patient because of risk of cerebral edema. Remember, we're talking about your CNS. You want to avoid that. Reduce high fever to decrease load on heart and brain from oxygen demands. Kapag active fever ang pasyente mo, you can give paracetamol, anong tatawag doon? Anti-hyperthermia medication, mga paracetamol, or you can do TSB. Okay? What else? Reduce, and of course, part of that is giving the stat medication or any antimicrobial as early as possible. All right? Next, we have protect the patient from injury. Remember, meron tayo seizure. Ito yon. Secondary to seizure activity or altered level of consciousness, LOC. Next is monitor daily body weight, serum electrolytes, and urine volume, specific gravity, and osmolality. Especially if a syndrome of inappropriate antidiuretic hormone o yung tinatawag nating SIAD is suspected. Prevent complications associated with immobility, such as pressure ulcers and pneumonia kapag bedridden, turning. Okay. We also have institute infection control precautions until 24 hours after initiation of antibiotic therapy. Oral and nasal discharge is considered infectious. Hanggat hindi na-rule out, hanggat hindi lumalabas yung result ng iyong LP, yung mga sined mong labs, ilagay mo yung pasyente mo sa droplet precaution. Malinaw? Malinaw. Huwag mong tatanggalin yan. Next, inform family about patient's condition and permit family to see patient at appropriate intervals. Visiting hours po. Okay? Thank you so much, you guys, for watching. I hope you learned something today. Please like, share, and subscribe to my channel for more nursing educational videos. You let me know if you have other nursing topics you want us to do. You comment it down below. Abangan mo nga yung upload natin this coming Friday because that is going to be a lot of fun. I'm gonna be posting about how to write your NCP. O, diba? Continuation ito ng first video natin about NCP nursing care plan where I teach you how to create NCP. Alright? So, tulungan nyo na nga ako, ipamalitan nyo na sa Radyong Sira, ang pinakabago, pinaka-fresh at pinakalibreng nursing review center sa balat ng YouTube. Excuse me. Don't forget to follow me on all my other social media accounts. Everything is at Neil Gave, except for my TikTok account, which is Neil Gave Official. I do have a podcast channel. It's 3 a.m. Conversation with Neil Gave. Check the one out. And I will see you again on Friday. You have a good one.